We have three incredible panelists this afternoon who are going to be addressing this issue. First, I want to make a couple of comments. Those of you who attended our spring meeting heard from Dr. Carrie Ressler with the Harvard University, who talked about this issue of PTSD in urban communities. What he told us based on his research is that people who live in high poverty, high density, violent communities often experience higher levels of PTSD than people on the front lines of war zones. And that is a shocking finding. What is PTSD? Well, it's been defined as a condition that can develop after a person has experienced or witnessed a traumatic or terrifying event in which serious or physical harm has occurred or been threatened. Our panelists today are going to take and talk about this issue and talk about it from a number of perspectives. The panelists are Dr. Maxine Hayes, who has dedicated her life to teaching and public service, focusing her efforts on disease prevention. She earned her bachelor's in biology from Spelman University in Atlanta. She has a rich bio, which I won't go into this afternoon, but I will tell you that she's received degrees from New York School of Medicine, Vanderbilt University in Nashville, Tennessee. She's worked at the Children's Hospital in Boston, Massachusetts. She's gotten a degree from the University of Massachusetts, and she's got a degree from Harvard. She served as the state health officer for the state of Washington. Please welcome Dr. Hayes, but hold your applause. We also have attorney Josh Horowitz, and he is the executive director of the Coalition to Stop Gun Violence and the Educational Fund to Stop Gun Violence. He's a graduate of the University of Michigan and received his law degree from George Washington University. He's currently a visiting scholar at the Johns Hopkins Bloomberg School of Public Health and is co-author of a book, Guns, Democracy, and the Insurrectionist Idea. We're joined thirdly by A.C. Wharton, the former mayor of the city of Memphis and mayor of Shelby County, Tennessee. He was the 63rd mayor of Memphis and the first African American to serve as mayor of Shelby County. A graduate of Tennessee State University, received his law degree from the University of Mississippi, where he also served on the faculty for some 25 years. Mr. Wharton was a member of the group Mayors Against Illegal Guns. He began an initiative called Operation Safe Community in Memphis. He developed programs to help prisoners develop the skills to succeed in life and support their families. And he was a principal for the initiative Books from Birth, a program that currently exists in Memphis. I gave you that perspective of his bio to let you know he's a natural fit for membership in the criminal justice section of the American Bar Association. We are going to actually have our panelists each present to you for 15 or so minutes, and then we're going to open it up to have an interactive discussion. So I call on Dr. Maxine Hayes, and first, if you would applaud all of our panelists at the start.
Well, thank you, Judge, and I'm just really thrilled to be here. And I want to thank Matt particularly because, you never know when you meet someone in another context how they can sometimes be the ones to connect you with the next contact. And I got to this because I was in the state of Wyoming as a guest talking about early child development. And you can't go any further upstream in terms of prevention than the way our policies really support families with young children. And it was from there that the connection with criminal justice and this judge was made. So I say that because, we need one another. I'm in the public health community, and how many of you in the audience, and thank you for staying, because, we are the last panel, And I said, I wonder how many people we'll really be talking to. But you stayed, thank you. How many of you have actually worked with some colleague in the public health community? Well, by the time I finish, I hope that if I ever ask that question again, everybody in the room will raise their hands. I really believe that we should be viewing violence as a public health problem. And the question is, well, why? Because how you look at a problem determines what you see. And what you see determines what you do. And in public health, yes.
Frame something versus a public health perspective. How is that different from a regular perspective?
The question
Well,
was, how
I'm
do
going
you
to get
frame
that.
something called public health?
Yeah, I'm going to get there. In fact, a good speaker will tell you what you're going to be told at the beginning, and that's what you're going to hear, because I've organized this so that we answer the question, but also give you criteria for even making an issue a public health issue. So that's going to be part of what I will do. So how you look at a problem determines what you see, and what you see determines what you do. On the public health side, we look through the lens of prevention. That is the hallmark. And on the criminal justice side, the lens is punishment. And so those are two very different ways of looking at the problem. And I want to explore with you the public health mission, because it makes sense to me. When I ask the question, why view violence as a public health problem, I also say, why not view it as a public health problem? What is public health? And I'm not going to assume that everybody in the audience really understands what public health is. And I want to say that there is a responsibility that society has in terms of assuring that the conditions in which people live, work, play, and pray are fundamentally supportive of being healthy. I mean, it's not just an individual responsibility. There are two responsibilities. There is the individual behavior, but I always say when people talk about individual and decisions on behavior, people are immersed in environments, and it's the environments that often shape how they will make their decisions. So you can't just say, you know, you should do X, Y, Z as an individual, because society determines what kind of environment or what kinds of conditions the people will have to make those decisions. And the public health mission up until 9/11 was assuring the health of the nation. And after 9/11, safety became a big part of public health work. And it was because of 9/11 that we began in the public health community to work with law enforcement around really security issues. And that's when we really developed some of our relationships, which I think will carry us through to work on issues like urban violence. I want to also contrast the philosophy of science, medicine, and public health. The philosophy of science is to discover the truth. The philosophy of medicine is to use that truth for an individual. But the philosophy of public health is to use that truth and apply and make sure that it is for everybody. And so the concept of social justice and public health is that you can't disconnect the two. It is a solid connection of understanding that justice, social justice, is an integral part of public health work. Public health is population health. When people ask as a public health physician, who are my patients, The whole population. I worked as the chief medical officer for Washington State for nearly 20 years, and then 10 years prior to that was the maternal child health director. And I can tell you that all of the residents of Washington State I considered my patients. When I was in practice as a pediatrician, it was one individual, one patient by one patient, which is individual health. That is medicine. But public health is population, and it's primary prevention. Medicine is about treatment and care. One thing that I want you to understand is that public health is not synonymous with charity medicine, because that's a notion that people have in their heads about public health, and it's not really true. It's more than that. Well, what makes a public health issue? And these are some of the things that determine whether an issue is public health. First of all, high prevalence of the condition. And there's this concept that those conditions can be prevented. There is a rapid increase in the incidence and prevalence, which is an epidemic-like proportion. And then cost and burden, and how capable is this issue going to affect the population as a whole? And it requires group action to solve. So these are the criteria in terms of what makes an issue a public health issue. And I think that if we were to overlay on that urban violence is a condition that meets every one of these criteria. We look at the presence of many forms of violence in our community, and I've listed, and this is not an exhaustive list, violence against women, racial violence, gun violence, police violence, prison violence, workplace violence, adverse childhood experiences. That's the ACEs, and I want to come back to ACEs because there's another issue here that I think you need to be prepared as we are preparing ourselves for a greater proportion of the population to be impacted by this, PTSD. And then there's structural violence. In other words, there are communities that by no fault of their own, but they're the recipients of policies that have gone awry, bad policies, and it's concentrated, and so they don't really have an equitable opportunity to even get out of their conditions and situations, and that's structural, institutional, and structural issues around race is one very good example. And then we have a very violent culture. In fact, I have traveled worldwide, and I can tell you that we are one of the most violent cultures in the world. And other people look at what is happening to us when we have 300 million people and we have just as many guns, 300 million guns in circulation. Most of them are in private possessions. And in 2010, because of those guns, in terms of not only mortality, because we like to count the deaths, but the people who survive these incidents also carry a cost. In 2010, it was estimated that $174 billion was the cost of gun violence. One thing that we are learning about violence, and it was something that was discovered by an epidemiologist physician, and you're probably very aware of this individual, Gary Slutkin, who was an infectious disease doc out in California, came to this conclusion about violence. Violence behaves and it, more importantly, responds like a disease. And so violence, if it's a disease, you know, we have treatment for diseases. It can be cured. And so we think if we have the public health orientation on this, there are things in infectious diseases that we do in public health all the time. And there are three things that determine how these infectious diseases can be cured. We interrupt the transmission. In other words, we identify and detect the perpetrator. And, and then we prevent any future spread of individuals who've maybe been exposed to violence but have not yet acted on their anger. And then we shift the norms. And these three things is what Gary Slutkin applied to violence. And he did so in a number of communities. Are you familiar with his work?
No.
No. Okay, but then I really need to tell you, because this is really significant. On the west side of Chicago, Gary was able to apply these three principles and was able to decrease violent incidents by 67%, almost 70%. And then repeated this in a number of other communities, so that today communities like New York and New Orleans, Louisiana, Kansas City, they're all adapting and utilizing these three principles to really impact violence. And he demonstrated that it could be cured. And since that time, the Institute of Medicine, now the National Academy, has done workshops on this. The mayors have embraced this as a strategy. But I'm very excited about it because it's something that we can use from a public health lens to work with others in the community. I want to very quickly just tell you about some things that are happening in the public health community, because the timing in terms of us working together on urban violence is right now. In the health community, what we are doing is rewriting the narrative on what health is. And health is more than just the absence of disease. In fact, when you look at health over a person's lifespan, access to health care is the smallest thing that you can look at in terms of contributing to a person's health. That's the medical care. But if you look at environment and behavior, that's 70% of the person's health. And again, I want to point out the environment is very important because individual decisions can be shaped by the environment. So that another way of looking at this is, again, over 70%, health behaviors and environment, genetics only makes up about less than 20%. But even their environment is important. And then healthcare is only 10%. But look at this. This is how we spend our money. 97 cents on every dollar is spent on care, when in fact the things that contributed most to health is not care. It's the non-clinical components of health, and we have got to put more money in the non-clinical things that happen outside of the doctor's office. That's the policy change that we need as a group of professionals working together to change the narrative on what health is and how we should pay for it. In other countries, they spend more on social services and supports for communities. We spend more on care. That's after the fact. What we need to be doing is putting money in conditions that can prevent these things in the first place. Society's commitment to build on this culture of health means that we have to make sure that all of our policies, we put the lens of health. How is this going to really improve health? And so moving forward, I think that we've certainly got to restore our trust in government, because so many of our communities, and we know what these communities are, they are the hot spots. We know them by zip codes. We have to attack the root causes of violent behavior and invest in those and eliminate the disparities. This is something I want you to remember if you don't remember anything else from this talk. we have a burden that is growing because we're going to have more people in our population that have had adverse childhood experiences. And those individuals come from adverse community environments. And together, that's structural violence with these individual exposures that will only swell as time goes on. And the poverty is the seed in the soil that really contributes to the negative outcomes, and we're all paying for it. Poverty, inequality, racism, sexism, violence, affordable housing, these are all the things that we need to be investing more in than treatment. We have more people that have mental health issues. In fact, 30% of some of the encounters that police have with perpetrators have mental health issues. So our law enforcement officers have got to understand these conditions and be trained. Okay, my time is up. But there is a vision that I do have that's grounded in the fact that, you know, we can work together as professionals and collaborate. And there is a good example of what the American Bar Association is doing right now with public health, and also with about 7 professional organizations that are physician organizations. It is the American Academy of Family Physicians, the American Academy of Pediatrics, the American College of Emergency Physicians, the American Congress of OBGYNs, and the American College of Surgeons, and the Psychiatric Association. Together with public health, they have a whole list of recommendations about guns. And I have that Annals of Internal Medicine, that volume there for you to see that some work is going on already with these professionals. And to remind you that we're the chosen ones for this period of time in our history. This is a tough time we're living in, but we could have been here at other times, but we've been chosen to be here for this time. And change will not come if we wait for some person, some other person, or some other time, because we're the ones we've been waiting for, and we're the change that we seek. And I look forward to leaving this meeting energized by what I've seen you already putting energy in to join public health in recreating a narrative in this country that will get us to invest in what truly matters, and that is improving the conditions in which every citizen should live and have a healthy outcome.